There have been no new deaths over the last 24 hours, leaving our total at 50. Of these, 32 were in residents of continuing care facilities. I know that people who have loved ones in long-term care and continuing care facilities are concerned about the risk of infection at these sites. I am too. It is not acceptable that elderly Albertans are being put at risk in a place where their health is supposed to be protected. We have put strong measures in place to limit the spread of infection at these facilities. We must do more. That is why I am working with Alberta Health Services to expand testing in the units of continuing care facilities that are experiencing outbreaks to now include asymptomatic residents and staff. This expanded testing does not replace or change any of our outbreak measures, and a negative test in someone with no symptoms does not change a need to be isolated for 14 days if they are a close contact of a confirmed case. What it does is gives us a better chance of early identification of new cases. Given that we now know people who may be infected with COVID-19 can potentially spread the illness before they show symptoms, testing more residents and staff in continuing care facilities will help us prevent further infections and deaths. Having said that, testing is only one part of the larger response, and it must be taken in that context. I know staff at these sites are doing everything they can to keep these residents safe, and we will continue to support them by ensuring our requirements around visitation, sanitization, and personal protective equipment are rigorously followed at all times. We cannot let up on these requirements during this crucial time. One particular situation I wish to inform you about today is the outbreak at the Manoir du Lac Continuing Care Facility. Earlier today, Alberta Health Services issued a news release indicating that they will be taking over administration of this facility after public health determined that protocols for keeping residents safe and well cared for were not being followed. The health and safety of residents in our seniors' care facilities is of utmost importance, and these measures are being taken to ensure that residents get the care they need. While we are focusing on this group at the highest risk of severe illness, we still need to protect each other in the general population as well. We must continue to stay home when possible, practice physical distancing when we need to leave the house, and if we experience any of the symptoms of COVID-19, including fever, cough, runny nose, sore throat, or shortness of breath, we must self-isolate immediately and complete an online self-assessment at the Alberta Health Services website to be referred for an appointment for testing. If you do not have online access, you can call 811 for this referral.
Albertans should be very proud of how we have come together to fight and defeat this pandemic. As the increase in hospitalizations and number of infections confirmed today underscores, we are not out of this. I know we're getting increasing calls from members of the public to reopen everything right away. But as I said last week, doing so and letting the virus loose would risk us having to come back with an even more stringent and widespread lockdown that would have even more devastating impact on our economy. So as we begin to plan the details of our relaunch strategy, we please remember, I say this to all Albertans, please remember that the best way we can reopen key aspects of our economy and get back to something like normal is if we continue to show discipline. And that means for so many of us, making sacrifices so that we can contain the spread, and then that will allow us as a cabinet, as a government, and I know that the Chief Medical Officer will allow all of us to move forward more quickly with reopening.